Today we will be discussing changes in pregnancy within the hematologic, cardiovascular, and respiratory systems. One of the first significant changes within the hematologic system in pregnancy is the increase in blood and plasma volume. The blood volume changes begin at 6 to 8 weeks. They increase about 15% by 12 weeks, and they peak at 32 to 34 weeks with a total volume increase of 40 to 50%. That's a total volume of 1,200 to 1,600 milliliters higher in pregnancy. Plasma volumes increase begin similarly at 6 to 8 weeks and rise at 45 weeks. This rapid increase happens within the second trimester, followed by a slower increase, and maxes out at 4,700 to 5,200 milliliters around 32 weeks. The increased fluid volume leads to our next point of hemodilution and physiologic anemia. Occurring with the fluid volume increase is an increase in red blood cells, although the RBC increase is not the same rate as the overall volume. Coupled with a slower increase of RBCs, there is a decrease in the hemoglobin concentration from the fetal uptake of iron, which then decreases the maternal CRIP by 3 to 5%, reaching its nadir in the second trimester. This all manifests in what we call physiologic anemia of pregnancy and hemodilution. On the surface, hemodilution sounds sort of scary, but it serves an important purpose of placental perfusion with decreased blood viscosity and a reduction of maternal effort within circulation of this new increased volume. A third honorable mention of changes within the maternal hematologic status is the increased hypercoagulable state. There are various clotting factors that increase during pregnancy, such as 1, 2, 7, 8, and 9. But right now, I'd like to focus on clotting factor 1, or fibrinogen, as we can correlate with the previous mentioned hemodilution. Fibrinogen levels increase by 50 to 80% during the first and third trimesters as a direct effect of hemodilution. This mechanism, although developed prenatally, aids in controlling hemorrhage during the immediate postpartum period. Changes in clotting factors can be identified with decreased PT and APTT levels. Cardiovascular changes begin early in the first trimester. To help compensate with increased fluid volume and the demands of increased vasculature during pregnancy, cardiac output increases by 30 to 50%, beginning at the first trimester and peaking at 25-30 weeks, when total blood volume is 5 to 6 liters. A manifestation of this increased cardiac output is a systolic ejection murmur. Changes in heart rate and blood pressure also occur during pregnancy. This typically manifests as an increased heart rate of 10 beats per minute and a slight decrease in the blood pressure. These changes occur throughout pregnancy, with the most significant change during the second trimester. Some of these changes are from increased presence of progesterone, which in turn decreases the vascular resistance, leading us to our third point. Third most notable change in pregnancy is the increase of regional blood flow to multiple organs. This regional blood flow to the uterus is around 50 milliliters per minute at 10 weeks, 200 by 28 weeks, and 5 to 800 at term. This increased blood flow to the uterus helps maintain placental blood flow and fetal oxygenation. Next, we have our respiratory system changes. We sometimes see dyspnea, which can result from an increased minute ventilation and pulmonary blood volume, enhanced sensitivity to CO2 levels, as well as hypoxia, respiratory effort altered from uterine expansion displacing various organs. The increased presence of progesterone increases CO2 sensitivity by over 60% by 20 weeks. The increased sensitivity to CO2 causes some tachypnea, as progesterone is a respiratory stimulant. Pregnancy increases tidal lung volume, and it occurs from mid-second trimester until term by 30 to 40%. The change occurs from elevation of the diaphragm and changes within the chest to accommodate the grown uterus, such as thoracic circumference increasing by 5 to 7 centimeters and the transverse diameter of the chest by about 2 centimeters. Finally, another change we have is within the nasal passages. Many women complain about having a stuffy nose when they are pregnant, but really what it is the nose becomes edematous and hyperemic within the 3rd trimester, hence the stuffy nose. I hope everyone learned something new from this video.